Okay, everybody, we're going to go ahead and start. I just want to make a quick announcement before I do the introduction. We have a combination of things that hopefully will go very smoothly for this webinar. I'm actually broadcasting from the National Healthy Homes Conference in Anaheim instead of my office from a borrowed laptop. And you will occasionally, if I'm not having my microphone muted, hear some background noise because of the number of people are here. By the way, Dave Dijak is sending his regards for those of you who know him. It's a fantastic conference here in Anaheim, and hopefully this webinar will go smoothly. I do appreciate your patience. So we're going to go ahead and get started. We are recording. We are going to keep this recording, and the PowerPoint slides will be available later on if you want to view these. So welcome to the 2018 National Healthy Homes Month webinar series. National Healthy Homes Month offers an opportunity to learn more about housing and its impact on health and provide resources to encourage local activities as well as empower families to protect themselves from hazards in their home. This June's outreach activities aim to greatly boost awareness and understanding of what federal and local resources are available to make a difference in the lives of all residents, regardless of where they live. For more information about National Healthy Homes Month, including resources for your program, you can visit www.hud.gov/healthyhomes. Today's webinar is Hoarding, presented by Dion Learman, Penn State. He's part of the Philadelphia Hoarding Task Force, Pennsylvania State University IPM program, and he's also a trainer in the Healthy Homes Training Center Network. We're pleased that you have joined us for this event. This webinar series is sponsored by HUD, Office of Lead Hazard Control and Healthy Homes, the USDA National Institute of Food and Agriculture, and the National Healthy Homes Partnership. This webinar will last approximately 45 minutes with 15 minutes at the end for questions. At the end of the webinar, you will be given information on links to additional resources for your program. We will be recording this webinar and posting it for your viewing later if you prefer. Finally, we ask that you mute your microphone during the presentation. You may unmute your microphone for questions at the end. If you have questions before then, please feel free to post them in the questions window, and I will read them to Dion so that he can answer them. And again, one last point, this is the last of this series of Healthy Homes webinars. We actually have a huge number of people who are on this webinar. We have over 300 people, so I do appreciate your patience. We might have a couple of glitches, but if you'll be patient, we'll make sure that everybody is able to access the speaker. So without further delay, Dion, it is my pleasure to have you start this webinar, which is actually the webinar that has had the most attendees this month.
Great, thank you very much, Michael. I appreciate the opportunity to present. So we're going to be talking today about hoarding and specifically how we as healthy homes practitioners can help make homes healthier for residents who hoard. And if you're a home visitor, I'm sure you've walked into scenes much like that on the right. I know I have, and things that are even more hoarded than that. I work for the Pennsylvania Integrated Pest Management Program, and we deal specifically with critter problems that people have. And that's what got me involved with the hoarding movement. And there is a Philadelphia Hoarding Task Force, which I'll talk more about at the end of this presentation. But basically what we're going to do today is talk about what we as healthy housing practitioners can do to help residents who are hoarding. So first of all, hoarding is defined as a persistent difficulty in discarding or parting with possessions, regardless of their actual value. Both hoarders and those who intervene in hoarding refer to stuff as a neutral term. You don't talk about junk or garbage or whatever, you talk about people and their stuff. Hoarding behavior usually has negative effects: emotional, physical, social, financial, and even legal, both for the hoarder and for family members, and often for others around them. Note that hoarding disorder is now officially recognized disorder by the American Psychiatric Association. If you're familiar with hoarding at all, you may think that it's classified as an obsessive compulsive disorder, but in fact, the American Psychiatric Association has classified it as social anxiety disorder. Keep in mind that hoarding needs to be distinguished from the term squalor. Squalor is extreme filth and the failure to maintain a home. Not all
Don,
not all
sorry to
hoarding
interrupt.
results in squalor.
So, Don, I just want to make sure, I apologize for interrupting. There's a little bit of glitch here. Um, I'm assuming that everybody can see the screen that you're presenting. I had one person that said they can't see the screen. I just want to make sure if you are seeing the screen, could you just one or two of you just raise your hands, just click on the little hand icon to make sure that you can see it. Okay, fantastic. Thank you so much. So everybody can see it. I just want to make sure because I'm doing a remote presentation. I just want to make sure that everybody can see it. So I deeply apologize. Please continue.
Okay, not a problem. So, oh, by the way, the recognition of hoarding as an official psychiatric disorder has made it available as a billing code. And so many social service agencies are now able to charge to bill against this code, which means that they are now beginning to offer more hoarding interventions. And this is important to learn about and to get in touch with your local social service agencies who may be involved in this work. And as I say, we will talk more about that at the end of this presentation. So in general, you'll find hoarding conditions result in a lack of functional living space, and that's common. Hoarders may also live in unhealthy or dangerous conditions. Hoarders often live with broken appliances and without heat or other necessary comforts. So let's talk about what, in fact, are the health-related hazards from hoarding. First is structural collapse. And this may actually come as a surprise to some people, but in fact, when you have very heavily hoarded rooms and homes, this actually exceeds the design specifications for the house, and there is, in fact, a distinct danger of collapse. For this reason, the fire department refers to hoarded structures as heavy contents because there is so much weight, which then can, as I say, can lead to structural collapse. Objects that fall or are sharp. And avalanches is actually a major problem in heavily hoarded homes. There was a famous case in the 1940s in New York City where the Collier brothers were actually killed when their piles collapsed on the one brother, who was then trapped and died and was unable to care for his disabled brother, who eventually starved to death. Fire is a distinct problem, as well as the weight of the contents. They burn very, very quickly. And there are actually some rather alarming videos online that you can look at for about fire department controlled burns that show the difference between a hoarded and unhoarded room. Basically, a hoarded room flashes over into full fire in a matter of less than 2 minutes, whereas an unhoarded test room built to the same specifications basically does not before it could be brought under control. Lack of egress is a big issue. It's a problem for the people, for the hoarders, because they can't get around, but it also is very important for emergency services. If an emergency fire or EMS crew cannot get into a home because the door is blocked by stuff, or cannot maneuver in the home because it is blocked by stuff, this can be very, very dangerous. And firefighters have actually been killed in hoarded homes because of their inability to move themselves and the hose line quickly through the home. Inability to use the space. This is a big problem, and you will often find that hoarders have completely filled things, rooms that were designed for other purposes. For instance, the bathroom, the tub or shower stall may be totally hoarded with objects. The kitchen may have every surface, including the stovetop, covered with objects and unable to use. Living rooms may be completely cluttered except for the one chair or couch that the hoarder usually occupies. And this means that hoarders are often unable to bathe, they may be unable to cook for themselves, and obviously this leads to other problems. Pests. This is how I got into this picture. In many cases, hoarded belongings provide many places for pests to hide, lots of harborage opportunities. If the person who is hoarding food or food debris, then the probability of pests is extremely high, and there can be enormous pest issues. And treating pests in a hoarded condition is very difficult. It is possible, but it is very difficult. Mold. Mold is not universal in hoarded situations, but it can certainly occur if there is unchecked moisture sources that will generate mold. And if piles, say, of papers become moldy, remain damp and become moldy, then that mold can spread and it can be quite a serious condition. And finally, we have trips and falls by the hoarder themselves and by visitors. In many cases, there may be very narrow lanes to pass through in a hoarded home, and there may be obstacles such as extension cords that block the way as well. And as you can see, these are all fairly common healthy homes problems. It's just that in hoarded situations, the amount of stuff becomes totally overwhelming. So how much of an impact how severe is the possible impact on the hoarder's health? As healthy homes practitioners, it is our work to make the home healthier, and we'll need to judge how much of an impact hoarding has had on a person's health. Fortunately, we have several tools that we can use for this, and these tools should be available for download, and they will be posted with the recording from today. The first is the Clutter Image Rating Scale, or CIRS. This tool has one set of pictures for the kitchen, one for the dining room, and one for the living room. The healthy home practitioner selects the photo in each set that most accurately reflects the amount of clutter in that room. The practitioner uses metrics such as the percent of floors and surfaces covered, height of piles, width of pathways, etc. So I don't actually compare the room to these photos while I'm in the home. I make a best guesstimate, which is very easy to do. These tools are very easy to use and to learn how to use, and being able to simply write down a number is very easy, fast, and discreet. And we would highly recommend all practitioners to adopt the Healthy Image Rating Scale as a uniform way to address the issue of clutter. Anything over a 4, that would be the first photo in the middle row there, is considered clinically relevant, and the resident should be referred to local hoarding programs if available. A 2 would not require a response. An 8 might start a harm reduction program with a goal of bringing it down to a 4. The International Compulsive Disorder Foundation notes that in our work on hoarding, we found that people have very different ideas about what it meant to have a cluttered home. For some, a small pile of things in the corner of an otherwise well-ordered room constitutes serious clutter. For others, only when the narrow pathways make it hard to get through a room does the clutter register. To make sure that we get an accurate sense of the clutter problem, we created a series of pictures and rooms in various stages of clutter, from completely clutter-free to severely cluttered. One way that this tool is used clinically is that residents can just pick out the picture in each sequence that comes closest to the clutter in their own living room, kitchen, and bedroom. This requires some degree of judgment because no two homes look exactly alike, and clutter can be higher in some parts of the room than in others. Still, this rating works pretty well as a measure of clutter. Again, in general, clutter that reaches a level of picture 4 or higher impinges enough on people's lives that we should encourage them to get help with their hoarding problem. So in clinical situations, these images help the resident identify the scale of the problem. From a healthy homes practitioner's point of view, this is a way of calculating the impact of clutter and the amount of it. Another excellent tool is the Homes Multidisciplinary Hoarding Risk Assessment. There's actually a second page on this as well that we're not showing. Excuse me. This tool involves a visual scan of the environment in combination of conversation with the person or persons in the home. The healthy home practitioner can use the visual scan and the conversations to determine the effect of clutter and hoarding on health, obstacles, mental health, endangerment, and structure in the setting. You can see these categories each have a number of simple check questions after it. And the more things you check, the more of an issue there are. The practitioner can also collect additional information on the backside on the hoarded environment and in the occupants and their capacity to address the problem. This Homes assessment was developed in conjunction with the Massachusetts statewide steering committee on hoarding. Boston and Massachusetts in general have been leaders in the hoarding movement here, and a lot of the materials that we use were in fact developed by people in the Massachusetts area. I'll point out that this assessment is not a diagnosis. It is, however, useful to be able to identify risk factors. Okay, so as healthy homes practitioners, you need to be aware of what does not work with hoarders and what does work. First, any kind of forced cleanout will not work. The hoarder will simply fill up the space again in a short period of time. Second, there are two approaches that do work. The first is a treatment-based approach using cognitive behavioral therapy, or CBT. The second approach is one that fits with your role as a healthy homes practitioner. It is called the harm reduction approach. We'll discuss what does not work and then what does in more detail now. You may have watched one or more of the hoarder shows that are on television. Beware that doing a clean out of a home, while interesting on television, does not work in real life. So this is what does not work. Explain that in the situation, I'm sorry, in the situation that they're describing on the screen here, there's some kind of individual or family, some kind of crisis, and a show arranges to have their home completely cleared out. Cleanouts are often quite traumatic for the person who hoards. Unless the individual who hoards receives some type of therapy, he or she will simply fill up the home again in a fairly short time. You may have heard of cognitive behavioral therapy. It is a common type of talk therapy that focuses on identifying negative or false beliefs and restructuring those beliefs in order to change behavior. CBT is an essential part of treatment for a hoarder, but note that the hoarder must, of course, be assessed and treated by a mental health professional. That is not your role as a healthy homes practitioner. If getting to the top of the mountain is a metaphor for the greatest success, it would represent having a person in their helping a person end their hoarding behavior. But hoarding is an extremely difficult condition to treat. Quite often, people who hoard refuse help because they show little awareness of the problem and with their behavior. That inability to recognize that they have a problem is a huge impediment for them seeking and accepting treatment. In addition, many hoarders have family members who often badger the hoarder to get treatment or throw things out. The hoarder typically reacts to this with a great deal of anger and resentment. Harm reduction sidesteps the hoarder's acceptance of treatment, and which emphasizes discarding possessions and stopping hoarding behavior. Instead, harm reduction focuses on discarding only that which is necessary to maintain the person in their home safely and comfortably. And this approach, by the way, has been well documented in several books, excuse me, and papers. So the harm reduction approach, specifically identified by Michael Tompkins in working with families of people who hoard, has 5 steps. And again, this is from a clinical perspective, but I'm going to be addressing it primarily in the context of that of a healthy homes practitioner. First, we need to engage the hoarder. Counseling the hoarder to help him or her find the motivation they need to start changing their behavior. And in some cases, this can be done with by pointing out the inability to use the shower or the kitchen or other parts of the home, and trying to restore functionality may be a good way to start to engage. Building the harm reduction team. In addition to the clinician and the hoarder, clinician will bring in family members, friends, services such as adult protective service workers, housing code enforcement officers, property managers, visiting nurses, and presumably you as the healthy homes practitioner in whatever official capacity you have. Third, we need to assess the harm potential. This is a series of home visits to assess environmental factors, including heating or cooling problems, and personal factors such as medical problems, and other support factors such as available family members or other community members who may be involved. And this specifically, obviously, is where we as healthy housing practitioners are most involved. Fourth, the clinician works with the team members to specify what will be done to reduce harm, how often additional home visits will be, and the role of each team member. This may also include a referral for medication evaluation or psychotherapy. A formal request for accommodation under ADA may be negotiated with property managers, specifying how much contents will be reduced over a period of time, usually 6 months. The goal is to make the space safe enough for the work to continue until it reaches compliance with code or other requirements. Fifth, the team implements a harm reduction plan over time. This continues as long as the person continues to engage in the behavior and to engage with the harm reduction. The focus remains on safety first and comfort second. Harm reduction often incorporates something called safety days. These are partial cleanouts. The resident who hoards participates in these days, and excess stuff is discarded. The focus is usually on establishing clear and safe paths, eliminating the danger of collapsing piles, and reducing weight on the structure. Keep in mind that the harm reduction approach focuses on making the house useful, not beautiful. Okay, so let's start to think about this from the healthy homes perspective. We're going to revisit those harms that we talked about earlier and look at what the harm reduction fix would be. So for structural collapse, we are going to reduce the weight and make structural repairs if necessary. We'll use safety days to reduce the contents and make the home safe enough to be able to be in compliance. Objects that fall or are sharp. Well, we want to reduce the height of piles, ideally less than 4 feet, and specifically identify and remove any sharp objects and make sure there's clear pathways. For the risk of fire, again, we want to reduce the risks, especially decluttering around the stove, heaters, furnaces. It's amazing how frequently people have cluttered their stove, believe it or not. You want to remove any combustible materials, and you want to establish clear and safe egress paths at least 36 inches wide. Specifically, addressing egress, you want to declutter around doors, make sure that there are wide enough paths through the house, at least 36 inches wide, with a clear path to a window in every room for emergency egress. This path should extend from the front door all the way through the house to any bedroom, to the bathroom, to the kitchen, as well as to the area where the hoarder spends the most of their time, which is usually in one spot. This path may be defined to make it frequently blue painter's tape is put down on the floor to define an aisle that the hoarder will agree to keep clear. People have been very creative, though, in developing other things. One gentleman taped a yardstick to his walker, and so as he walked through his home, he was able to ensure that he had a 36-inch wide pathway. Okay, so inability to use the space means decluttering enough to restore function to crucial rooms, especially the bathroom, the kitchen, and the bedroom. In many cases, hoarders' beds may be completely piled with materials, making them unable to sleep in the bed. Many times people are sleeping either on their couch or in a chair, especially if it's a recliner chair. And with pests, what are we going to do? Well, we're going to assess for fixes based on integrated pest management and incorporate steps into the harm reduction plan. And with integrated pest management, of course, we want to remove food, water, and harborage that allow the pests to thrive. Cockroaches and mice are a big problem if people have been hoarding food or food debris or other organic matter. And they can be controlled, even in a fairly hoarded environment, by removing the food through the use of cockroach baits and gels, through the use of trapping for mice. We do not recommend the use of rodenticides in people's homes. Bed bugs, on the other hand, can be extremely difficult to eliminate in a hoarded, if not impossible to eliminate in a hoarded environment. It may be possible through the use of heat, but that's going to be very difficult because of the mass of the hoarded material and the risk of combustible materials. And so it can be extremely difficult to treat hoarded homes for bed bugs. There may be ways to do it, but it's not easy. For mold, as always, we need to identify the source of excess water or moisture and stop that, fix whatever problem that is before we can get rid of the mold, which we simply scrub away with soap and water. HEPA vacuums are also useful for removing mold. To mitigate trips and falls, we again need to declutter enough to maintain those pathways through the house. Okay, so we have talked a lot about what you can do as an individual Healthy Homes practitioner. But the New York Times reported in 2013 that over 85 communities have created hoarding task forces. These task forces reflect the complicated nature of addressing hoarding, since they typically include people from support as well as enforcement perspectives. And I mentioned earlier on that I'm a participant in the Philadelphia Hoarding Task Force, and this is a very large group with a number of different agencies involved. We just had a conference here in Philadelphia with about 150 people in attendance. And they come from all over. We have people from animal control, from elder rights organizations. We have participants from Clutterers Anonymous, which is actually a hoarders self-help program. We work with people from behavioral health. We have property managers who work with us, community legal services, many city health and behavioral health agencies, various social service providers who work with elderly or with people with disability or with other chronic conditions. Licensing and Inspections is a city agency that does housing enforcement. The mayor's office, mental health associations. There's a National Association of Professional Organizers who are very useful and referring hoarders to for help. Office of Supportive Housing is our homeless agency here in town. There's my program, who got involved, as I said, because people were running into pest problems. And when we go into homes for pest problems, we often encounter hoarding situations. The Corporation for Agency, the Housing Authority, the Fire Department has been a critical part of the Housing Task Force and is particularly useful because firefighters are popular people, and often a uniformed firefighter can actually get access into a hoarder's home where they have refused admission to police or licensing and inspections, simply because firefighters are not there to do bad things. They're there to protect health and safety, and people recognize that. So having your fire department involved can be very helpful. And they are extremely concerned about this issue. If you think about 3 to 5% of people who hoard in Philadelphia, that adds up to about 75,000 people who could potentially be hoarding. And that's an awful lot of fires. And the risk for the fire department is very real. Another essential group of people to get involved with are tenants' rights. Hoarding actually frequently comes to light when a property manager or other building staff conduct an inspection or enter the apartment for repair service or some other reason and realize that they have a hoarding condition. And in many cases, this will violate the lease. And it also is a structural issue for them and a big safety problem. And so they will demand that the hoarding be eliminated and issue an ultimatum. And quite often the hoarder either is unwilling or unable to comply with the order, and then it proceeds to eviction, which can be extremely traumatic for everybody involved. Working with tenants, with management to come up with a reasonable accommodation plan has been very successful, and most property managers are willing to do that. It's less time, less money, and less aggravation than eviction proceedings. Typically, the resident will contract with the property manager for a specific amount of reduction over a specific period of time, usually 6 months. So, for instance, if the hoarding is at CIRS level of 8, they may contract to reduce it to a level of 4 with specific guidelines, including 36-inch egress paths, piles no more than 4 feet high, and functional areas returned to their intended use. So at this point, we're going to open it up for questions. We have plenty of time, and I'll try to answer whatever issues people might have.
Diane, that's great. Fantastic presentation. So I'm going to ask people to actually post their questions in the questions window, and then I will read them to Diane. I do want to mention that Susan Assetti at the Healthy Homes Training Center posted a link to some of the resources you were talking about earlier, and I put that link in the chat window. So if you will look in your chat window, you can see where that link is.
Excellent.
Okay, so one of the questions, I'll be able to answer some of these questions because they're logistical. So on the recordings. We are recording these, and within a few days next week, all of the webinars for each of the 11 that we've done will be posted on a HUD website, and our National Healthy Homes Partnership website. And everybody that's registered for a webinar, which means if you've attended this one, you will actually get emailed a link to all those recordings. So I will have those sent to you probably early next week. So one of the questions that came in is, who does hoarding cleanup in Philadelphia for clients who can't afford to pay for the cleanup?
Well, that's been a problem. Ultimately, in many cases, the city will end up assuming the cost of cleanouts, which can be quite expensive. Average cleanout ends up costing almost $10,000.
Wow.
Yeah, yeah. And as I said earlier, it's largely ineffective. In many cases, if in a forced cleanout, if the client does not receive any kind of therapy or support, the the hoarder will simply re-hoard, and the situation that took 10 years to develop will be replicated often in 6 months' time. So we really don't recommend forced cleanouts. It's much better to do safety days where you look to reduce the volume of materials and to have people do regular decluttering. So,
Uh,
yeah.
thank you for that. This may be the same answer to the question, but a person viewing the webinar in Maryland is saying, I'm in Maryland. Are there federal or state funds available to help hoarders?
I'm unaware of any federal funding for hoarding. The main change was the inclusion of hoarding as a psychiatric code, which, as I said, it now enables agencies to treat that and bill the healthcare insurance provider. And in many cases, that's going to be Medicaid or Medicare. And so that's the way that funds are available to help hoarders.
So there's a question that came in. I think you partially answered this, but just to make sure that everybody got the correct answer, what is the next step if they don't want to declutter?
Well, that depends on their situation. If it's a private home, there may not be a next step. If they're living in a rental unit, though, the management is going to have something to say about that. And that is often the lever that gets people to take action. The threat of eviction is pretty powerful for hoarders. They have an intense emotional attachment to their stuff, and the idea that they and their stuff would be thrown out is very traumatic for them. And so at that point, they may agree to some sort of harm reduction in order to prevent eviction and a full clean out. But
Good. Okay. So there's another question. How do we find resources in our states like Kentucky? You showed a slide earlier that listed a huge amount of agencies that provide that. I'm assuming that different states have that type of resource available, but since a lot of people are obviously interested in hoarding because there's not a lot of information out there, there may be why so many people are at this webinar. But if you have any other like national resource where there's a database, we may want to send it to people as a follow-up to that.
yeah.
A couple other things. Again, I apologize for the background noise. Someone is asking, has anyone tried the same concept like Biggest Loser in weight management, but in hoarding?
Um, not that I'm aware of. I'm unclear exactly how a competition would go in that way. Um, in many cases, hoarders do not view their behavior as a problem. Um, they People hoard for different reasons. There may be a sentimental attachment to things. There may be instrumental attachment, that is, things may be useful at some point in the future, or they may even simply be aesthetic, that they like that the objects. And so getting people to discard is very difficult and emotionally fraught. And uh, most most clinicians recommend that people spend no more than 15 minutes a day trying to declutter at a time, because longer than that, it becomes emotionally difficult. People get involved with the stuff and uh, don't don't end up discarding. So short, frequent work on the problem is more useful than spending hours or days trying to get through it.
That is definitely good to know. So we'll take a few more questions.
Mm-hmm.
One person is asking, how do we address a situation where there's a foul odor in the property while trying to be as sensitive as possible? I think they're looking for how you diplomatically
Mm-hmm.
address that.
Yeah. Well, like all healthy homes challenges, that one's a big one. Um, you can ask, what is the source of that odor? Um, and people, again, may not recognize it. With odors, your body physiologically ignores them after a certain amount of time. About 5 minutes or so, you simply no longer perceive the smells. Um, and this can actually be quite serious if their odors are have health implications to them. So the hoarder themselves may not even be aware of the odors. And if you say, "I'm smelling something. Is there a source of an odor in here?" Um, the hoarder may not be aware of it until you say that. Um, Always asking questions about things is going to be a good, uh, relatively non-aggressive way to ask things.
So some of these questions I think came in at this about the same time, so we may have covered those. But
Mm-hmm.
one question is there a support group, either, I guess, nationally for people who want to change the behavior that cannot, that may not necessarily have mental health access? Do you know of any like organizations that address that?
Yes, actually, Clutters Anonymous is a national organization with chapters all over the place, and they have regular in-person sessions. However, they also have a monthly phone session where anybody can call in and talk. And this is, I understand, I've not been on one of these calls, but I understand they're extremely popular and viewed to be extremely helpful by both clutterers and by people responding to cluttering. And so that just look for the website for Clutterers Anonymous, and there should be more information about that there. And this is a very nice resource, especially for people not in urban areas who may not be able to find other kinds of support groups.
Fantastic. So, a couple more questions. By the way, this has been a fantastic presentation. I have learned so much from this, and I'm sure everybody else is feeling the same way. It's definitely a topic that we're glad that someone's addressing, because it's just something that we know about and we have a lot of clients with it. But knowing how to professionally deal with the situation is really fantastic. Someone is asking about if we have elderly. With people over 80 years old that have hoarding issues and they go through a clean out, I'm assuming voluntarily or involuntarily, has there been any research into the effect it has on their longevity?
Good question. I'm not aware of that. There may very well be research on that issue. There is much more work on hoarding being done in the last few years, but I'm not sure that I'm not sure.
Okay, so the next question is there's a comment from somebody. It says, "Love that you've adopted the term stuff. How do you incorporate person-centered planning to empower the resident as central to the success of harm reduction model? For example, using person-first terminology such as person who hoards instead of hoarder."
Absolutely, absolutely. And we try to be very careful about that. I confess that I'm less good at that than my social work trained colleagues, um, but that is absolutely correct. Um, and it's important um, to the residents to respect them and to not denigrate them.
Good, good point. Questions come in. How do you address the person who gets rid of things but continuously keeps adding things to their unit? This is probably a good candidate for support from a mental health or physician or somebody that can actually give them some help to address the long-term problem.
Yeah, so this would also be a good role for a professional organizer type person. Uh, Typically, the way that works is that there are weekly sessions in the home when the organizer works with the client for no more than an hour, uh, and often there's a series of bins set up for stuff that gets discarded, stuff that gets recycled or upcycled or whatever, and then stuff that is being retained. And you and there may also be um, work around issues of continuing acquiring. So trying to cut that back, making covenants that to not continue to purchase. Um, in some cases, family members have had to do things like uh, cut off people's access to credit cards or other payment forms to prevent that. Um, but sometimes it can be very difficult. Why do I keep bringing home books when there's no more room on my bookshelves? Um, it can be a very long-term project to cut down on the amount of stuff and the continuing of the acquisition.
That actually is a good segue into, we'll take a couple more questions to the last couple of questions. The first one, and I'm going to tie these two together because I think there probably is a relationship. The first question is, what kind of questions should you be asking a hoarder when you have the initial consultation? And then someone is asking if you could define, if possible, the difference between someone who has clutter and a person who is, by definition, a hoarder.
All right. Well, let's take the second question first because that's definitely easier. Um, so clutter turns into hoarding when you have lost the use of the functional use of a space. Um, when the floor and all surfaces are covered and the piles begin to climb higher. Um, Collections disintegrate into hoarding when they can no longer be properly displayed and viewed. Um, so, for instance, having a lot of books is one thing. Having your books double shelved with books behind books and piles of books on the floor reaching up, that's become a hoarding issue now. It's no longer just book collecting. Um, and the other question was about what kinds of questions to ask people.
Correct.
Um, Again, you always want to try to get a sense of from the resident. So you might ask something like, "Wow, you have a lot of stuff. What what in some cases you may be unclear exactly what it is, so you may say, what is all of this, or uh, why are you what does this stuff mean to you, is probably a good question to ask. um, Not I would again avoid things like what's with all this junk mail? Or why don't you take the garbage out? Um, those are not going to be helpful questions. You want to have, or statements, you want to ask open questions that try to elicit information or feelings from the resident that can start to get you a handle on it. And you may find out, oh, well, my wife died, and my mother died, and my father died, and I got all their stuff, and I can't figure out what to do with it. And that's going to tell you a lot. It tells you about that the person has gone through a lot of loss, that the acquisition of stuff was largely unintentional, but that they are disempowered and unable to take the next step. And that client is going to be a lot easier to work with than one who, for instance, has been hoarding adult diapers and garbage bags in the basement.
That is good to know. I appreciate that. So I think this will end the webinar. Diane, I really appreciate you deciding to do the last one. As a reminder to everybody, we are recording these webinars and they will be posted, and everybody that has registered and even people who registered but could not attend will be given information on how to access the recording. So I appreciate everybody being here. I appreciate your participation in National Healthy Homes Month, and Diane, a special thanks to you for giving us the largest attended webinar this year. So I hope everyone has a good day, and hopefully we'll be able to work with clients that are hoarding better than we have in the past. So thank you.
I would just encourage everybody to reach out to other agencies and to start looking at this issue and developing a local task force and understanding what resources are becoming available.
Great, thank you. So I'm going to stop the recording, and this will end the webinar.